This is Dr. Suneela Garg, ex-Sub-Dean and Head of Department Community Medicine at Maulana Azad Medical College. I have been serving as Professor of Excellence for over 3 decades and have been associated with the Department of Occupational Health for a similar period of time. I also have been Chair of Program Advisory Committee at National Institute of Health and Family Welfare, which is a policy think tank to Government of India. And also have been involved in creation of multidisciplinary units, which are research units created in different medical colleges, along with being advisor to World Health Organization and Indian Council of Medical Research. My association with Department of Occupational Health particularly made me, think about different issues like use of asbestos, and particularly its use of asbestos in cement, when we say, and leading to making of rooftops, and especially its use in schools. When the rooftops are made in, used in schools, it is particularly very, very dangerous because over a period of time, the fiber of asbestos is released, which has got ill effects on children and also adults. It is not that only children are exposed, but why we are worried about children is that when they are exposed at a teenage, the cancers and mesotheliomas, which is a long-term occurring cancer, takes time, and by the time they are into adulthood, instead of being healthy, they are suffering from cancers, which is a huge problem. Asbestos not only leads to malignancies and all, but it also leads to carditis, pericarditis, and if the person is smoking, it doubles the risk of having respiratory diseases like chronic obstructive pulmonary disease. And we do see with multi-drug resistant tuberculosis, it has got a compounding effect on the health of the individual. It is high time that we have really looked into this issue, and the use of asbestos, particularly when we construct the rooftops and all that, and also when we are looking at pipes and other areas, its use has to be carefully looked at. I'll say that it has got to be banned. Though when we talked in 1990s, the use was banned in mining particularly, but now we have to raise this issue not only with regard to schools, which should be a priority area, but also we need to look at any other building which is using asbestos. So we must look at this issue on a priority basis so that we can prevent our teenagers, we can prevent everybody whosoever comes in contact with the fibers of asbestos.